Good morning, everyone. My name is Darshan Mehta, and I am the Education Director for the Osher Center for Integrative Medicine, and we wanted to welcome you to our grand rounds this morning. Just before we get started, just a couple of logistics. You will see in the chat information about how to request CME. For those of you who are requesting CME, please email Dan, and we'll put it in the chat, and as you can see, it's in the chat here. So please email Dan to request CME credit for this morning's session. And also, just to just a quick plug for our next grand rounds, which will be on Tuesday, July 6th, and we will have Dr. Gloria Ye, who will be giving a talk on studying the intersection between mind, body, and physical activity in cardiopulmonary disease. So it'll be an exciting presentation. Really look forward to having you join. This will be on Tuesday, July 6th, again at 8 a.m. Here virtually. So again, we're just really excited to get started today, and really pleased. I'm excited to have my colleagues from Mass General join us, and I'm just going to briefly introduce. They're all very accomplished individuals in their own right, and in an effort of having a wonderful discussion, I'll just keep my introductions brief. Irene Martinek is the co-director of the Catherine Gallagher Integrative Therapy Program and program manager for acupuncture and massage therapy. She is really focused on ensuring access to free and low-cost services and fostering clinical excellence through development and dissemination of safety and practice guidelines. And their team is also working on MGH's new comprehensive sickle cell disease treatment center to treat pain and other symptoms with integrative therapies in ambulatory and inpatient settings. And I've been lucky to have known her, as well as Lori Kubicek, who is co-director of the Catherine Gallagher Integrative Therapies Program and program manager for the Expressive Therapies at the MGH Cancer Center and MGH and Mass General Hospital for Children. And she brings a tremendous wealth of experience around medical musical therapy, and just brings her passion, which I've been fortunate to have experienced over the many years that we've known each other. And then finally, but certainly not the least, Dr. Jeff Peppercorn, medical oncologist specializing in breast cancer, director of supportive care and survivorship for the MGH Cancer Center Survivorship Program, and associate professor of medicine at Harvard Medical School. And again, in addition to his clinical and administrative roles, has published over 150 papers on topics related to bioethics, health policy, cancer survivorship, and serves on national committees. And again, I've had also the fortune of getting to work with him over the past several years as well. And so I will turn it over to them. Again, please put your comments in the Q&A section in your feed. Again, we encourage you to just want to really encourage a lot of discussion and dialogue. And so after the presentation, we will have some time for Q&A as well. So I'll turn it over. Lori.
Thanks.
Or Jeff, yeah, sorry.
Hi, yeah, this is Jeff Peppercorn. Thanks, Darshan, for that nice introduction for all of us. And I want to make sure before we jump in, I also introduce patient who's been kind enough to join us and really lend her experience for us to talk about today. So Heather Bartow, who I'll be going into the clinical presentation a little bit more, but I met as a 42-year-old young woman who had breast cancer detected on screening mammogram in July in the middle of a pandemic, and is doing well, smiling, and is here to tell us about it. So you'll hear more about Heather immediately, but we're really thrilled that she was willing to join us and able to share her story. So the case. So this is about a 42-year-old 42-year-old woman who had the cancer detected on a screening mammogram, had the screening in July of 2020, and then had biopsy, which confirmed that it was invasive cancer, estrogen receptor positive, and HER2 positive, so a type of breast cancer that we treat with special targeted therapies, as well as chemotherapy and endocrine therapy. She went on because initially the cancer seemed very small, so we were hopeful that she could potentially get away with a relatively simple regimen. So she went on to have surgery first with a lumpectomy and was found to have a 1.3 centimeter cancer that matched the imaging, and also had one involved lymph node, which threw a little bit of a wrench into things, because this suggests that if you just give the simple regimen we wanted to, the cure rates may not be perfect. So we gave a more involved, that Heather could speak to, involved regimen called TCHP, which stands for docetaxel, carboplatin, and then 2 antibodies targeting HER2, trastuzumab and pertuzumab. Now with this regimen, the good news is the cure rates are fantastic. We expect that she and others with this treatment will be cured. But it is not an easy one to go through. It involves chemotherapy every 3 weeks, 6 times. So that's about 4.5 months that you're undergoing chemo, although most of that time you're just coming to the outpatient clinic and then going home. As I said, excellent likelihood of cure. And then you get the 2 antibodies, trastuzumab and pertuzumab, to complete a year total. So it's a lot of trips to the infusion room. The full plan for her involves surgery, the chemotherapies I just described, radiation therapy, which we do when there's a lymph node, and then endocrine therapy. And there's even another drug that we can talk about down the road that you could throw in. We won't, not for the purposes of this conference. But that's a lot of treatment. So next slide. Now, worth mentioning the toxicity, because this is partly, today is about symptom management and how to improve patients' quality of life. So Heather can correct me if I left anything off. I'm sure I did leave some things off, although this is enough. Nausea and vomiting, not just once or twice, but real vomiting, thrush, yeast infection of the tongue, fatigue. She had a rash to her arms and her face at times, diarrhea, heartburn, severe heartburn at times, lack of appetite, bone pain, hand swelling. And when the nicest thing that the doctor can say in the quotes of, how's the patient doing, is she kept most of her hair. You're having a rough go. But that was the case. And then this is just to give you a sense of the medical management, the things we could do: IV fluid, ginger, antiemetics for nausea, nystatin and magic mouthwash for the thrush. IV fluid, again, seemed to help with the fatigue. Benadryl helped with the rash, Imodium for diarrhea, omeprazole for heartburn. There's not a great regimen, remedy for lack of appetite beyond trying to control the nausea. Oxycodone and steroids for the bone pain, hand swelling, similarly, maybe steroids help with that. And she did use cold caps, which resulted in helping control the alopecia. Next slide. And I think more than those list of drugs, which are what I have to throw at a patient and hope that they help, she really got phenomenal care by the nurse practitioner I work with here, Lauren Winters, who really saw her on one of the visits. I think I saw her initially, and Lauren saw her one of the subsequent ones when Heather was having a rough time, and devised this plan of coming in a couple days, in addition to the infusion schedule, coming in later, getting some IV fluid, getting an additional assessment. Heather can speak to it better than I can, but I think that really that's unusual for us to do that, but I think that made a huge difference in getting her through this safely with a better quality of life than we could otherwise. And as you'll hear, integrative therapy, despite, again, this happening in the middle of the pandemic and all the restrictions we had, we were able to get integrative therapy, meaning both our acupuncture team, expressive therapy, and others involved to give her the best quality of life possible, help with these symptom managements. And of course, it helps that she was an extremely patient patient. There's no doubt that personal attitude and the positive disposition that I think you'll see today makes a difference in how people do with this tough regimen and tough situation. Again, going through breast cancer in the middle of a pandemic at age 42. Next slide. So those are my only comments, but I'll be around later to address additional questions about her clinical course.
So I told my parents recently this weekend when I visited them that my degrees finally paid off with a master's degree in healthcare administration and a bachelor's degree in recreation therapy. So everything finally paid off with my education. And I can share some of these highlights with you. And I do have smiles, and I do have a fairly positive disposition. But when you meet a care team of this magnitude, that helps you get over the humps. That helps you trust that you're in great hands. And my job was to get well and follow the plan that they put forth with me. So in a lot of ways, Mass General has made it easy for me because everything is very seamless from the patient perspective. And so the timeline that I put in front of you, I worked as a lean process improvement specialist for the state of New Hampshire, and I work in project management. So finally, some of these things come to play, and I'll tell you why those things matter. So from the patient perspective, a lot of complex medical terms are thrown at you, a lot of information, everything went very quickly. And I'm very good at digesting information and spitting it back out, and I get paid to do that. I get paid to ask why. So now flip that switch over to my personal life. Using those same skills helped a lot during my experience and continued experience with Mass General. And so some of my key points in care, Dr. Peppercorn, I can't call him Jeffrey, I have to call him Dr. Peppercorn. Some of my key points are he's already identified when diagnosis was and et cetera. But I know no different breast care other than during a pandemic. And I certainly never felt alone with the extensive care from the nurses that have gone above and beyond from the first point of care coming in to get the consultation all the way through to where I am today. So I know no different, and I cannot say enough good things about it, the care at Mass General. Some of the pieces that I think that are helpful for conversation and learning today, and as well as when you're treating your patients, what helps from a patient perspective. And I look back at my medical record, I look back at some of my Facebook posts when I created a group, and I look back at reflecting of things that I had written down, some journaling during my experience, and felt that certain points, acupuncture as a whole, anything that Mass General offered me, I said, yes, I'll try everything. So I was the yes patient, whatever they had to offer, from clinical nutrition consult to massage therapy to acupuncture to the infusion, whatever it was, I would try anything just because I wanted to feel better and have my best health outcome. So insert stage left from Mary, where I met Mary at Waltham at the Cancer Center. And Mary dropped in and said, hey, I have some acupuncture. Would you like to learn about it and potentially have a session? So right away I said yes. And immediately the next day after I had acupuncture, I had a reduced bone pain and reduced pain in general, and felt better. So I had no idea what a golden nugget that I had walked into. But each time I said, make sure I see you every 3 weeks, make sure I see you every 3 weeks. And then we brought Karen in for massage therapy as well too, and that helped alleviate some of the bone pain and back pain and some of the other symptoms. Mary was fantastic. She had suggested that I consider her background as in nursing. She had considered maybe coming in for an infusion a couple days after I had chemotherapy to help hydrate me and push some IV fluids. And that was a great addition to my care. But Mary also was pivotal in saying, you know, maybe you should think about in between sessions a community acupuncturist. So that was another great suggestion. And so having a community acupuncturist really helped put the pieces together while in between sessions of coming at Mass General. So I've been working with Kristen Marquith in Concord, New Hampshire, and she has been fantastic to work with. I'm actually seeing her later today to be able to help alleviate some of the symptoms and going through a breast cancer diagnosis. There's a couple of busy things on this slide, but I think it's important to know one of the things I was telling Lori about was when I was going through radiation, I had said, okay, I have to find some way to look forward to something. It's 80% of this cancer journey is a mental kind of tricking your brain to get to the next stage, get to the next piece. And it's definitely a lot of sprints. So I had to be able to kind of wrap my head around that and how can I do that? And I did that through music. So the wonderful radiation therapist in Boston had Pandora playing, and they said, let us know if you want to hear anything. I said, bingo, every Friday is now Dave Matthews Band Friday. So each Friday after I had completed sessions for that week, they had it already playing by the time I got in there. So how the heck they would remember me out of all their patients that they see, hundreds of patients each week, if not thousands. And the fact that they would remember and take that away, that they knew that that was just a few songs I could listen to while I was getting radiation, was really, really pivotal. So, and all you can see that I had the massage therapy and acupuncture treatments, treatments at pivotal points and what they've helped with. And I cannot say enough good things that acupuncture has added a tremendous quality of my patient experience at Mass General.
Thank you, Heather. And just to dovetail on Heather's comments, the timing of our return to the location where Heather got treatment was really fortuitous. all of our services were suspended beginning in March, and fortunately, our massage therapist and acupuncturist at MGH West, where Heather got the bulk of her treatment, returned on September 29th, which was the day she started treatment. Both of our clinicians in that site are also registered nurses, and they were deployed during the height of the pandemic in their nursing role. So that really had an effect on our ability to return care to MGH West. But one of our main real priorities is continuity of care. And fortunately, we were able to see Heather for acupuncture in Waltham and massage therapy at MGH West in Waltham during her infusions for chemotherapy. When she began radiation therapy in Boston, we were able to continue that also with our acupuncture team here, and now continue with Mary Tricoli, our acupuncturist, to the present. Next slide, please. So I just want to step back a bit, and there are a couple of things I want to emphasize in terms of what happened to the Integrative Therapies team during the height of the pandemic, and then also our return to providing in-person care. As we were considered non-essential in-person providers, and so our in-person services were completely shut down from mid-March until we got the official okay to return in the beginning of June. One of the things I want to emphasize is that our integrative therapy staff were deployed. Some people were able to work from home providing virtual care, which my colleague Lori Kubicek will discuss later. But the vast majority of us were on site working in a range of roles. As I mentioned, some of our staff was deployed in nursing, but we had integrative therapists working in the ED. We did patient transport, we delivered meals, patient screening, mass distribution. We were really an on-site presence. One example of the significance of the changes is that one of our dedicated inpatient oncology units became a COVID ICU, and all of our oncologists and nurse practitioners had a significant change to their day-to-day way of life in the midst of this unprecedented time. Fortunately, we were able to begin virtual care within 2 weeks of the shutdown, and that is largely due to the expertise of our expressive arts therapist and one of our acupuncturists, Nate Langford, who has technical abilities. And so our team internally collaborated really closely in getting as much care as possible in telehealth and doing a series of classes and workshops and webinars so that patients could continue to access our services during the shutdown. We got the official okay to return in the beginning of June, but that phased return to clinical care was a very involved process. Acupuncture and pediatric music therapy, because of the significance of music therapy to pediatric patient well-being, both physical and mental well-being, that was returned earlier. But we were phase 2, step 1 of the return. Massage therapy and other services were in step 2. And in order for us to return to in-person care, we had to abide by both guidance from the CDC, but then internal requirements from infection control, and then the State Department of Health's very rigorous stepwise process and guidance for how, when, what circumstances it was possible for us to return to inpatient care. Next slide, please. So for the DPH and infection control, we had a long list of things that had to be in place before we could actually see patients. We were required to, in writing, have a patient care prioritization policy. And we were limited in terms of our on-site staff people. Initially, it was at 50%. So in order to cover as many patients as possible, particularly those with the most acute needs, we had a lot of schedule juggling to do. We had to attest to having adequate access to PPE in all of our clinical locations. And our integrative therapies team works in both ambulatory and inpatient settings, and we're in about 12 different settings, ambulatory and inpatient. So in all of those locations at a time when there were concerns about adequate access to PPE. We had to, again, in writing, attest to the fact that all of our providers had access to anything they might need in any clinical location. We worked very closely with infection control to ensure that our changed workflows conformed with infection control requirements. And in addition, we spoke with the nursing and clinical leadership in all of the clinical settings where we returned to ensure that our presence on the floor would be helpful and would seamlessly fit into all the changes they had to make to workflows to adjust to treating patients in a pandemic. And we had to prioritize the use of telehealth when feasible. That one of the things we found really helpful was when patients were referred to our interventions, we did our initial intake and initial education sessions via telehealth so that the in-person visit could be really focused on providing the hands-on clinical care. We also had a robust in-person student program, both acupuncture and expressive arts therapies. So students were not allowed on site. However, the music therapy students did an amazing job providing virtual care under Lori's leadership. And the no visitor policy, I think Heather has a really interesting perspective on the pluses and the minuses of the no visitor policy. So I think I'll defer to her to speak to that. Next slide, please. So going forward, we in the before times had a very busy group acupuncture clinic and radiation therapy. That clinic, I don't anticipate returning largely due to space constraints. So we had 5 recliners in a room and 1 acupuncturist was able to treat patients in this group setting. The room where we provide that service is simply not large enough for us to have adequate space between recliners for patients to get treatment. So that has been transitioned to a one-to-one where she was able to receive treatment during radiation. Unfortunately, that's limited our capacity because we are no longer a group clinic. And then the other thing I wanted to mention was we probably will continue with the virtual classes, workshops, and webinars because we got so much positive feedback from patients about how helpful it was to be at home with a caregiver or family member and watch a webinar or participate in a class. And particularly if they weren't feeling particularly well, to be able to get support from other patients and also from their known care team. So that will no doubt continue. The other thing that's really promising is the return of our outdoor space. We have a wonderful healing garden in one of our adjacent to our patient care areas in the ambulatory setting, and that is now open to patients and visitors. We previously were able to provide workshops and classes in that setting, and our hope is to be able to again host some in-person supportive care service workshops and sessions. We may return in a hybrid model, but that's to be determined. Next slide, please. And as always, we return to our core care principles. And one of the most challenging things about coming back was that we are a model of care that relies on continuity. We are committed to following our patients regardless of where they receive their care throughout the care continuum. So infusion, radiation therapy, if they're admitted, if they're in the clinical trial center, the Tumira Center, and care coordination within integrative therapies, but also with our nursing and oncology and other partners is key. So care coordination and communication went to a completely different level during the pandemic because information changed so frequently. And I think some of those ways of communicating, we need to continue to really work on that. I also want to mention the importance of ensuring that care is available more broadly, that I hope and anticipate that we'll be able to provide more integrative therapies at other locations, which is going to help the patient experience and enhance access. And to that end, our staff went through a lot. Deployment was challenging, and as integrative therapists, we're often called upon to be supportive to our other clinical colleagues. that was a secondary aspect of what those providers who were on site and those who provided virtual care were part of. So as we shift into whatever this next stage is going to look like, we really need to focus on continuing to ensure staff well-being and staff retention, and as part of that, to really actively participate in both our community efforts and then our hospital's efforts at addressing racism and healthcare disparities, which were so heightened during the pandemic. And now I'm going to turn this over to my co-director and colleague, Lori Kubicek, who will speak about expressive art therapies during the pandemic. Thank you.
Thanks, Irene. So this is just a kind of a quick peek into what expressive therapies looks like then and now at MGH. So our music therapy program, as Irene said, has been continuing both in person and virtual. Our training program was able to maintain itself throughout the pandemic, which has been really wonderful, and has actually made us a pretty highly sought after internship program right now, because students can get so many different experiences, inpatient, outpatient, virtual, group. It's been pretty wonderful. I also manage all of our arts and healthcare programming. So the Illuminations program brings very high quality art into all of the waiting rooms of the Cancer Center, both at main campus Boston and in our satellites. And that has been a really like a beacon of light for many of our patients who were in those waiting rooms by themselves, separated from anybody. And they got to see all the art on the walls. That was really wonderful. And it rotated several times throughout the pandemic. I also started a collaboration with the Boston Hope Music Program that came out of the COVID site down in downtown, and they were bringing live music there, and they made all of these cultivated playlists from musicians in the area, and they're really beautiful playlists that they were able to bring to the patients. And they're also doing a lot of wonderful virtual programming, teaching essential workers how to play instruments, and they did a songwriting project with the ICU patients. And so I've been a part of helping them kind of develop some of these really unique virtual programmings, and it's all with docs at MGH. Our environmental music program has been on hold, although we did go virtual for a little while and did a wonderful webinar series in the height of the lockdown. But we are working with infection control to start bringing some of our musicians back to play in the public spaces of MGH. And art therapy right now is on hold. We had some staff reductions and some budget restrictions that have changed the program. So we're waiting to kind of see what that's going to look like as we start kind of coming out of this pandemic. So in our process of transitioning to virtual care, there was really three main components. One is collaborations, really looking at all of the logistical details, which there were many, many, many logistical details, and then thinking about the clinical considerations and challenges. So one of my favorite parts of the initial transition to virtual care was myself and a couple of my colleagues created a music therapy telehealth collaborative, and that was with medical music therapists from all over the country and from abroad. There wasn't a ton of us, there was 12, but we were very powerful 12, and we represented some of the many different kinds of medical settings: children's hospitals, cancer centers, hybrids, and even some of our competitors from across town were there at the table, and we were all sharing resources. And we were all learning just through doing and working with each other. My team would get together and we would try to figure out how to do Zoom sessions with a group of people, or I reached out to my 15-month-old niece to try to figure out, how do you do a music therapy session with someone with very limited attention span? So it was really about reaching out and kind of working with what we had, so that when we did finally get face to face with our patient virtually, we were able to work some of those nuts and bolts out. And then, as Irene said, really then taking all of that information that we learned and then sharing it with our integrative therapies colleagues to help get our yoga groups up and running. And again, if you can work out the nuts and bolts, then you should definitely share it with those that have not had that opportunity yet. there's a lot of logistical components in doing virtual care. And then even more when you're doing live music virtually. So the first thing that we had to figure out was how to deal with the latency issue with live music. But again, we worked that out in our collaborative and learned that there are certain situations where the burden of the delay that happens when you're doing live music can be taken on by the therapist if you do it in a certain way. So if we're the leader and they're kind of listening to us on the other end, it sounds perfect to them. We hear the delay. So we have just learned, and we train our students, you just have to ignore it and know that it sounds good on the other end. And if there are moments where we want to kind of, like if you're in a group, then we've had to decide like, okay, everyone can go on mute, or the patients in our weekly music therapy group that again have been meeting every week since the lockdown, they choose to leave themselves unmuted, because even though like the quality of the music is a little questionable in those moments because it sounds kind of cacophonous, they hear all of that as collaboration, people, community. So they choose to leave themselves unmuted all the time. And I love it. Had to work about, sound. How do you get the best sound? Microphone, not microphone. How do you get good lighting? How should you be in your screen? So all of these kind of different components really made a huge difference, especially if either the staff person or the patients themselves weren't feeling very confident with technology. So how do you problem solve that ahead of time so you can help them be as less frustrated as possible? And one of the things that we had to really normalize for ourselves and for our students is anytime you do something virtually, especially when you're trying to lead an active music session, and I completely made up this statistic, it takes 3 times the effort to do what you usually do when you're in person. So at the end of the day of virtual sessions, you feel absolutely drained. And if you just know that that's just the way it is when you're trying to bring like a 3-dimensional experience through a 2-dimensional screen, then that can help you, better set yourself up to, for self-care and for expectations and those kinds of things. All right, so we'll move on. Some of the clinical considerations that we thought about is that it was very clear that there was a high necessity for group programming. And this was not just for patients and families, but also for staff. So we would do a group sing every week through the pandemic to bring staff together. We created new programs. We added 2 more virtual groups during the pandemic, and those receptive music groups they just work very well. So this Use What Works is really kind of a testament to that. There's so many things that actually translate absolutely beautifully in the virtual world. Some of our most evidence-based and robustly researched interventions, receptive music, songwriting, creating playlists for pain reduction or motivation or exercise, and just active music, all of those interventions really worked. So we just really used what worked. Clinical instrument lessons were a little bit challenging because in person we could just bring the patient an instrument, and when we're doing them virtually we had to figure out how to get the patient an instrument. So thankfully we've gotten a wonderful grant from the Eileen Beale Foundation that has helped us to get instruments into patients' hands, and that's been really wonderful, especially during the pandemic. Again, my niece really helped me figure out how do you maintain the attention of very young patients over Zoom. But one of the reasons why we got back to in-person services in pediatrics first is just because it just works so much better with pediatrics when you're face-to-face. And then one of the challenges that we still reach today is how do you get to those new patients? Because access to care and referrals, it's tricky to have these services be on like the very front part of the staff's attention when they're trying to manage all of these other components of it. So that continues to be something that we work with. So our pandemic pearls. One of my favorite things that I think came out of it was the Integrative Therapies webinar that Irene and her team really helped to coordinate and pull together. They were an opportunity for us to collaborate with supportive care services outside of integrative therapies, nutrition, psychology, lifestyle medicine, physical therapy, to really bring very specific symptom management ideas to cancer patients. And we've done 2 different series, one a little bit more global, one very focused. And the wonderful thing is these are now online on our website and available for oncology patients anywhere outside of MGH. I've sent these to family and friends all over the country because they're just really high quality webinars. And also, as Irene said, virtual care just equals increased accessibility. So, and we've been able to expand services now to Waltham. So that's a really wonderful thing because now we can do virtual sessions there. The access to groups for patients who have disabilities, who are fatigued, who are far from Mass General, that has increased, and they've just come week after week after week. It's this constant source of support for them. And there has definitely been an increase in inclusion in family in our sessions when appropriate and indicated, and that's been a really wonderful thing. And one thing that hasn't also changed is the importance of music for connection and wellness. And that doesn't matter if you're with a music therapist and you get to really see what that's like to have that evidence-based clinical relationship, or if you're like Heather and you're like, I need something to help me move from one part of this treatment to the next. And she was able to utilize that herself, which is just the beauty and power of music. So with that in mind, I'm going to actually hand it back over to Heather, and she's going to give us some of her recommendations.
This is interesting to hear your perspective from Lori and Irene. I wouldn't have known any of it from the patient perspective, that these parts were being orchestrated or that they weren't already seamless. So you did a great job from the front side of it. I just saw everything was together and was impressed that succinct, quick, professional delivery of services were just on point at all points in time. So little did I know that you all were living through these components of the pandemic professionally, and then had just, maybe been redeployed to your correct profession. And not that the nursing background isn't helpful or patient transport things, but you were redeployed back to your real day job. And so that's an interesting perspective. And I didn't know that was happening, and that did not come across with the services that I received with acupuncture and massage therapy. I remember specifically during acupuncture, getting care from Mary, certainly, but also during radiation, where I had a lot of skin burning and pain, and my pain levels were, I like to say I have a very low pain level, so I'm very aware when I'm in pain for something. And I remember walking in and getting treatment from Hugo, who was just fantastic. And my pain level was probably at an 8 or a 9, and I was just fatigued from 30 something sessions from radiation, the daily trips to radiation. And I had said to him, I'm just tired, but I'm in pain and I'm too tired to take a Tylenol. And he chuckled, and we talked about radiation. And then, he came in, he did his treatment, and I'm laying there, and within 10 minutes, the pain was down to much more manageable, 3 or 4. And that lasted for several days. So remembering those pivotal pieces for me, as you're talking through when your program came back together, from being deployed, from being back to your regular day job, I just wouldn't have noticed any of those things from the patient perspective. These are just a couple of recommendations that I thought of as I'm going through the program. I have offered in many ways to help whatever I can do for Mass General. So from the cold capping was a great experience. It is important for your hair, and I know it's not related to today's topic, but it's part of your mental health. And so for me, that was something that I chose to do, and it paid off for me mentally. And I was glad that was another addition to Mass General, and that's why they're #1 in care. So I think it's important to, when you're thinking about working with your patients, I didn't know necessarily, Lori had mentioned that integrative therapy is at the forefront of people's minds when they're caring for their patients. I, again, wouldn't have known that from my side because it was just so prominent in discussions. When you come in, you're saying, and I feel like my complaint list would grow each week, what it is. And I almost didn't want to report my symptoms because it was just annoying to keep talking about it at home every day, but then come in to say, by the way, I've got 12 things I'm reporting today, or I've got 3, or etc. But in order to get better, in order to have a better quality of life, you have to be transparent and have a good relationship with your doctor. And so I had told Dr. Peppercorn early on that I'll be a good patient. I'm very good at reporting data and information back to you. So then that informed best next steps. So providing the clear benefits of the integrated therapies, I think it's helpful, and giving some examples of what you've heard, patient stories and etc. You can use mine. Please use mine. Radiation made a huge difference during it. Bone pain from an elasta shot that I would get the day of chemotherapy and would go off 26 hours afterwards. It's a shot that goes in your arm to boost up your immune system. Bone pain was significant for that, and getting acupuncture significantly reduced the bone pain that I was having, which in turn created less reliance on medications that I need to be able to treat the pain. So being able to have some of these alternative approaches were really helpful in your tool bucket as a patient. I think it's important for your patients to hear both in writing, so they need something to go onto your website or on paper, as well as verbally. There's folks learn both ways, right? So they need to be able to hear that information about integrative therapies and the value that it offers programs. I think it's missing on your website. You need to give yourself more credit. You need to be able to share some of these stories, whether it's patient stories or vignettes of things that are happening, or positive experiences through making it through a pandemic, but then also how you're rolling these programs out. The more communication, the better that you can have will help patients when they're doing their research. I ended up at Mass General through research. I looked at a couple of hospitals in Boston and ended up with Mass General when I saw #1 research hospital, and then I could go in and find out why, and it's backed up in there. You need the same thing for integrative therapy. It offers so much value to patients that it just needs to be put out there. One of the things that I felt was a little bit more clunky or a little bit more cumbersome from the patient perspective, when I was in, when I still go to Mass General every 3 weeks, seeing Mary, she just knows I'm on her list, and there's magic that happens behind me. That is how I get referred for care, and she keeps coming back to see me. It's great. But on the flip side of it, when I was at daily radiation at Mass General in Boston, it was a little bit more complicated to make appointments. I had to call, leave a message, and the person would get back to me the next day. So if there's some way to improve that experience for the patient, I would recommend sort of looking into that to be able to smooth out that process. The time and slots were available. It's just more of a delay of getting things in. And I think I could have gotten more treatments if I had that. And I also didn't know sometimes if radiation was running behind, is it okay to go to acupuncture 20 minutes late? I wasn't really quite sure about how to navigate that, being mindful of everyone's time and knowing that it is a one-to-one setting. So I don't want to overlap in someone else's spot where I've come in late, because either I was running late, traveling an hour and a half into Boston every day, or, which I think only happened once magically, also, but radiation, because of the various complexities, sometimes they're running a couple minutes behind. I think just in general, really encouraging and making it part of every single appointment of what are you doing for your supports from the patient perspective, and reminding providers that it's not just come in and get medication and report symptoms. There's so much more to an experience for cancer care, and just reminding patients that there's many facets along those care. I thought of my journey as a filing cabinet or an interstate. So during my experience was a filing cabinet. So I would pull one drawer open and take out whatever I needed from that drawer, and then close it and go to the next one. So starting from surgery and diagnosis to chemotherapy and radiation, and certainly as I'm more of a long-term range now, I've got that 4th drawer that's open to say, what does survivorship look like, and what does that mean to me along the future, and anything else that I can contribute to my own personal wellness. One of the other things to consider that from my perspective is having a peer mentoring program. I've helped a lot of people. Just I like to talk, I like to share my story, and if I can help someone else, I think that's a really great opportunity to be able to give back to folks and a pay it forward concept. So I've been able to do that, personally in my hometown and across state lines for sure, and just sharing your experience and sharing what you've gone through. And so being able to develop some sort of professional peer mentoring program, sign me up. I'm happy to be part of it and contribute to other patients' care, that when they have some of those questions of someone has gone through something similar to what I have, or considerations in your holistic perspective from patient care lens. And I have pictures of beaches on the bottom of each slide, because each time I made it through one milestone of my care, we visited a beach. So we went to Nahant Beach, we went to Wells. I went to Wells one weekend, beach in Maine, and as well as Hampton Beach in New Hampshire. So I'd wait it anytime I could get to water. It was like I made it through another stage of care. And sometimes it was me just sitting there in the car and I couldn't really get out of the car, but that was just another mental health component I developed for a strategy. I want to take a second here to peek at something. I called it my wall of cards. And my 2 kids, I have 2 kids and my husband, we've been married for 15 and a half years, and my kids are 13 and 8. And the amount of information and support coming in from me as a brand new cancer patient and navigating through this as a pandemic, but just as a person and never having complex medical issues previously, it was overwhelming, the amount of cards that were coming in from folks. So we put this wall together in my house that it was filled, and this was just one point in time. It was from ceiling to the floor, and we put the cards together, and each time I came home from chemotherapy, I read every single card, and sometimes I couldn't quite read up to the top, so I'd have the kids get on a step stool or something and have them read it to me so I could remember all the things that people were saying and encouraging me and telling me stories, people that I hadn't even met before that wanted to give gift cards or well wishes, etc. And so that helped me. So each time I came back from chemotherapy, I read that because I knew the days ahead were going to be really tough for me. And I needed to kind of just set myself and center myself mentally. And then I would do the same thing when I was feeling really well to go back again. So I had to go back through that cycle 6 times, and each time it was a little bit worse. So spending the time to read those cards really helped me a lot. And one of the things I learned very quickly and had to wrap my head around was just being able to say yes to help me. People want to help, and they couldn't take away my cancer diagnosis or necessarily be there for my care, but they want to help. So being able to say yes as an independent person was very hard for me, but I had to do that early on. And then most recently, I've been working on a couple other ways to give back. I dropped off a care basket for the nurses at my last visit with goodies that my friends had put together. And it was essential oils and soft leggings and coffee gift cards. The Dunkin' Donuts gift cards, I think, went the fastest for the nurses. But it was really a care basket to give back to them for all the great things that they have been doing. And another layer of that has been, I created my own pay it forward approach with my HB care packs. So I've delivered 40 care packs to Mass General and Waltham, and these are packaged, they're all in Ziploc bags so people can just take them and go. And they're homemade bears. My mom's best friend Bonnie, she's made these bears, and she's calling them support bears, and each of them comes with a little handwritten note that talks about how it can help during your care and how to care for your bear and all of those pieces. And we have some other homemade pieces in there. My twin sister created some during the pandemic, and probably moving forward, we're wearing masks. So the mask wouldn't necessarily fit very well over my cold cap. So she sewed 2 buttons on the side. So she put together some button packs that has 2 buttons, a needle, thread, and some instructions on there of how this can help you for something when you need to put a cold cap on and you need to be able to pull back your mask on there. It's just a little easier to take it on and off. So some of those pieces have been contributing to my care and how great that's been able to pay it forward. And I think because I'm in such a good place mentally from my experience, I've been able to kind of clear my head and say, this is where I have been and this is where I'm going. And one of the things that were important to me was to give back to others. And I'll never meet people that these will go to. And that's even more powerful, that it's going to help people in a lot of different ways.
Thank you so much, Heather. That was, again, such a beautiful, beautiful perspective to see it from all of these different lenses when we're looking at integrative therapies during a pandemic, to really see it from, the in-person perspective, how it transitions to virtual, but really what it's like day to day for a patient and your family. It's just such a gift. And thank you so much for sharing that with us. We wanted to wrap this up with just sharing some of our resources that we have at Mass General Cancer Center. This lists our website that has many of the resources, but I definitely love your idea of getting more of those case vignettes and just really concrete patient examples up on the website. And we're definitely going to be following up on that. But there is our online calendar. That webinar series is there, which really are wonderful resources for all different kinds of very specific symptom management questions. The group information about yoga, we have a breast cancer specific group, general cancer care, virtual music therapy, are active and more relaxation based. And we have an integrative therapies at home YouTube video series with some breathing and stretching videos as well that are quite wonderful. This is our contact information if you wanted to reach out to either Irene or myself for any other questions. And again, thank you all so much for taking this time with us. And we're going to send it back to Darshan for any questions.
Wonderful. This is, first of all, thank you to all of you for a fantastic presentation, and specifically thank you, Heather, for just being so generous to all of us and sharing your journey with us. I think I'm gonna have a question for each of you, and I'll maybe do it in the order of presenters. Maybe first start with Jeff. I'm curious from your perspective, when the pandemic hit, and the integrative therapies initially were decreased in their availability to patients. Was there a change you noticed in sort of approaches to non-pharmacologic, or did you see an uptick in pharmacologic management of symptoms that were typically, people had become used to having non-pharmacologic approaches help support their care?
Yeah, it's a great question, and I actually have not seen data on it. It would be interesting to have our pharmacists pull the data and see, did narcotic prescriptions go up? Did antiemetic prescriptions go up? I suspect that some of what happened is not that we ramped up a lot of medical care, it's just that quality of life went down for our patients during those initial days of the pandemic. Of course, also realizing that in the months, as bad as it was to be diagnosed during the pandemic, this was July, August, et cetera. March, April, we were trying to only have people come in if there was no alternative. So even as adjuvant therapy, we probably still would have needed to treat Heather, frankly, but many, just the general use overall. But yeah, this was challenging times, and I'm glad you got to hear. First of all, it's fantastic that Heather experienced it, I think, more or less as it would have been without the pandemic, which is a credit to the whole care team. But also, I'm glad that everyone in this group, and I'm sure others listening in the audience, got to share this on their own perspective, how hard this was on the caregivers, particularly even as that slide went up. We know that the whole, non-essential. So inappropriate that we use that term across society, but obviously inappropriate here. And as people were getting deployed for risky things, at least in that time of the pandemic, serving food and transport in the ER, but not able to use their skills to help their patients and colleagues, was just very challenging, and nice to see us emerging from it.
Thank you, Jeff. Well, that's actually a great pivot. I'll actually actually ask a follow-up, and this came also as a question from a participant in the audience. In terms of Lori, your work, and again, I was deployed to Boston Hopes. I had an opportunity to experience some of the work that you had led there, but just thinking about what was your experience on the emotional toll on healthcare providers, and how did you sort of appreciate some of the, or were you able to somehow basically get a sense of what the benefits that healthcare providers experience as a consequence of sort of some of the opportunities that you led and provided?
Yeah, I have to give a very big shout out to the Boston Hope Music Project, which again, I'm just kind of consulting with, but they really are very focused on getting services to healthcare providers that are very music-based. Again, we did it ourselves by leading our virtual choir and ukulele test drive group that I'm doing with staff. But what I saw through all of these different experiences, whether or not I was primary lead or I was helping kind of figure out all the nuts and bolts of it, was that staff are hungry and desperate need of these kinds of services that help them to pause this part of their experience and focus on themselves. And music happens to be one of those really beautiful things because it's processed throughout the brain and releases endorphins and all of those kinds of wonderful scientific nuggets that happen. That's a really wonderful intervention for staff to help alleviate some of the isolation and just refocus their attention back on themselves. So it was a powerful experience to watch, for sure. And, just wish we could have done more and wish we could still do more. But at the end of the day, people are also just very busy. So to carve out those moments for either self-care or to get together with a group of people continues to be hard today. So we just keep doing our best.
Thank you. Irene, I'm curious, sort of as we, one of the audience members asked, in terms of acupuncture being a sort of point of delivery sort of service, and in the pandemic, you couldn't have people come or were limited in how they could come to MD. How did you identify community-based providers in acupuncture to help support care? Was there a way that you help support patients in identifying at their, providers near their home, or did you communicate with providers across your network, or how did you develop a network?
So during the shutdown, there were no community-based services available. So this is really talking about after the return of care, and we have a list of providers that are that we can recommend to patients with an understanding that the specific criteria they should discuss with their provider in terms of being a cancer patient. There are very specific clinical needs and considerations that need to be addressed. So really guiding patients in what kinds of questions to ask when looking for community-based providers. We don't specifically vet the providers, but we can provide patients with a list of clinicians in their area who have oncology-based experience. And then the patients with our guidance can make those assessments on their own.
Thank you. And Heather, I'm going to give you the last word here. In terms of, when you think about, you obviously are here amongst a team of amazing providers who have sort of guided your care. I imagine you may have seen a provider or two across your journey who may not have been as supportive or as sort of collaborative. And I'm just curious, how did you have the dialogue around integrative therapy services with the provider, if you were able to even?
I just want to say I'm not being paid to say this, but I have not come across that in Mass General at all. I was diagnosed at a community hospital that really didn't have their ducks in a row, and I already knew from just being diagnosed in the process of that and how it happened, how clunky it was, and just that there was disconnections in the care and everything was kind of stretched out. I knew that they wouldn't meet my needs. And so just doing some independent research, that's how I arrived at Mass General, but I have not found that lack of coordination or collaboration or those pieces. Everyone is, when you talked about, patients first, that is exactly what comes across with every single person I've had interactions with in Boston and in the Waltham site. I know no different on this side, and I can't speak enough about the high quality of care, the professionalism. And, I think just being from the patient perspective, you have to be vocal, you have to speak up, you have to advocate for yourself, you have to be organized. One of the things that Dr. Peppercorn asked me early on was, would you like to be part of this app that we're doing some research with an organization? And I said, sign me up. I didn't even know what it was yet, but when he said app, I got that. But it also helped me keep organized so I could keep track of my symptoms and my side effects of the medication, which helped me report the symptoms back, and then we could talk about adjustments with care and etc. So I only know the best care, and again, not being paid for this, but yeah.
Well, I just want to take a moment again to really thank all of you for really a wonderful presentation. I hope you're seeing some of the comments on just how really many of our audience members appreciate sort of the patient-centeredness. And thank you, Heather. Again, I just want to reiterate our gratitude for you sharing your journey with all of us and really being vulnerable with your own self with our audience and we've greatly benefited our education. I just want to, again, we're at the hour. So again, thank you to our audience for being and for participating. Just as a reminder, next month on Tuesday, July 6th, we'll have Dr. Gloria presenting on studying the intersection between mind, body, and physical activity in cardiopulmonary disease. We would invite all of you to attend and look forward. And these grand rounds, as always, are recorded and are available on the Osher Center website. And we look forward to seeing you next month. Thank you, everyone. And thank you again to our panelists. And thank you, Heather.
Thanks.
Thank you.